So what I'm going to do is actually it's happening reasonably seamlessly, to be honest. It's the conversation is progressing through to what does action look like and what is the opportunity I'm passionate about the industry part of this and how do we make sure that the industry is best positioned to support its sort of stakeholders with whatever these opportunities are. And to pick up kind of the last question, I'm not in any way advocating we have to have an Australian medical cannabis brand, but I do believe we have to be united in what our Australian medical cannabis promise is, because regardless of whether there end up being a little mark or not, the word Australian on there is going to mean something, and we know that from all of our other experiences in these other markets. And I'm really pleased to say that we started putting that foundation down a number of years ago. Okay, so what did that look like? And so I was given the opportunity, and with Rosemary, we pulled together a group of industry stakeholders, not dissimilar to what we've just been doing with respect to the market access grant. And we put them all in a room together. So this was early in the industry, and I think Anne-Marie made the very quite salient point that they were all ultimately competitors. And so what we did is we got them in the room and we said, let's take all of the competitive part out, let's get to, all those years ago, what is the pre-competitive piece and which bit can we agree on as an industry, which one enables us to, I guess, succinctly explain and justify to external stakeholders who we are, but also what I was looking to do was to put what was a long-term kind of strategy underneath this concept that we wanted the industry to be trusted. And at that particular point in time, my main focus was doctors, right? And patients and regulators and those stakeholders which you don't normally associate with a brand promise. You're usually talking about consumers. So what came out of it was we did a workshop, and it was mostly around, how we drove it was, what are the policy parts that are required? What are the practice bits? So the what are we trying to achieve from a promise perspective? How do you then do it? From a performance perspective, and you can see here one of my presentations over that time, this was back in 2020 at this particular event, is how do we get to some version of walk the talk? How do we use platforms like this to take away key messages to achieve the incremental changes that we need from a regulatory perspective? And then as you come out the back end of that, it becomes about how do you make sure all of us are actually doing what we say we're doing? And we've not quite got to there yet, because obviously we've had lots of conversations about the fact we're competing with incoming product in particular that maybe doesn't hit those expectations. So I always like to ground these conversations, and firstly, I come to these events because I want us to have the hard conversations. But Deepak made a really important point that context really does matter. And so it's important that we temper what we want to do and our expectations with some realism with respect to where we've come from. Cannabis is very unusual, right, in terms of how, from a policy perspective, we handle it, right? And so in some markets around the world, we've made the decision that we're actually going to regulate the same product in two completely different ways. It's pretty hard to find other products that are like that. And that's because of the really complex kind of patchwork of history that we've got with the cannabis plant itself. Place where it was illegal, and whilst we might all be able to generally agree that it shouldn't have been, it supported very, very sophisticated illicit supply chains run by very sophisticated criminals to achieve particular outcomes, and we can't change that fact. And so whilst I'm an advocate, we just can't rewrite the history, and so we need to temper. And so if you think about that in the context of what we've done here, so 2016, right? We went to medical here, and the purpose of this slide is to say, how old are we? right? And so even at kind of 8 or 9 years, what that does as an industry is it puts us into year 4 from a schooling point of view and an education point of view, because it's pretty hard for the first few years, other than to survive, certainly. It's pretty hard for us to get to the really hard learned lessons. And so, like we heard a bit of it on the panel this morning, which is that, you know, like we've got some companies that are really struggling because of some of the rules and whatever. Now, this stuff comes about because of the fact that this is still in quite a startup phase. And so I look at it, having worked across lots of different ag supply chain markets, and I say we actually have got, which is not going to be a lot of consolation to the people that are really struggling, but there's been a lot achieved here. And what we need to do is continue to push through the next steps, of which the foundation of that work is this ATMAC work that Rosemary just presented on. Like all good scientists, I have to have a Wikipedia plot in there. I couldn't find a sensible, I think I might steal Deepak's, I quite liked his kind of graph. It's really difficult to find a single picture that represents how cannabis is being managed globally, and hence why I've used Wikipedia. I have no doubt, in fact I know for sure, global sector of which there is now a need for supply chain development, which in the more kind of globally traded commodities, the market kind of sorts that out. Because we have this patchwork of regulation and an ongoing change, you end up with some pretty big challenges around islands of supply, in particular accessing often very underdeveloped supply chains, which is, you know, to some extent sits behind some of the conversations that we've had today around dumping from the Canadians. I don't think it's a particularly, you know, new point to say that harmonisation of regulations is going to be a key. Having worked in the food and ag space as long as I have, we're still fighting about harmonisation of regulations. And so that's not something that gets fixed, it's something that changes and hopefully gets better each time. And coming back to the points we've made here, it's important that we have a couple of questions or a couple of asks that we're trying to achieve. Again, this is just tempering expectations. So, you think a bit about the supply chain. I'm a supply chain guy. So, what are the connectors here? Ultimately, you have, for medical, you have a patient, right? Most regulations stop us from communicating directly to that patient because of the rules around advertising, because of the fact that it's an unapproved medicine. But irrespective, there's still a need to connect the supply of cannabis products through to an end patient with lots of connectors along the way, which is a very big ask of an industry that's only in year 4 in primary school, right? And so there's lots and lots of pain points still here, but as we heard this morning, with persistence, probably no doubt capital, there is definitely ways to do it. And what I'd like to do is, as from an industry perspective, is how do we help with specific pain points, and how can we consolidate those questions into, we need this one solved, this will create this amount of value. So looking to the future, and this is building on Rosemary's work, what is the opportunity? This hasn't changed from when we first presented this concept, sort of 2019, 2020. And some of this learnings doesn't come from cannabis, it comes from any of these products that you're looking to trade globally. Transparency is critical. You cannot undo bad behaviour, and you cannot undo not sharing, and you cannot undo hiding. And so one of the reasons why transparency sits at the bottom of the code of conduct is because at an Australian level, we're trying to protect the reputation that we have globally. I think there's immense opportunity around technical. I think there's lots of opportunity to learn from other sectors. We're not all going to be good at supply chains. You think about biotech, pharma, and those relationships. The challenge we have in cannabis is we've almost exclusively chosen to go down an unapproved pathway, which also limits. But that's a decision we've made, and so now we need to figure out how we actually make it work. What is competitive, and I'm not going to get stuck into the really detailed part of this other than to pick up on a point that was made earlier, which is some of it is for you as brands or you as businesses to compete, but I do believe, as we've found with the grant, that there is immense opportunity around the pre-competitive or the co-opetition part, where we get to actually work together to sell a message. All right, so what does the opportunity look like? I don't need to spend much time here. Deepak did a fantastic job of showing kind of the fact that the market is material, and I think the point he made on stage here is in 5 years' time it's going to be a lot bigger than it is today. I always like context. The Canadians, I think, monthly have, Deepak can correct me, I think 1 million kilos of cannabis in inventory, right, ready to hit supply chains. You cannot have that sort of supply sitting there without there being tensions in the world's supply chain. We exported 1.5. We only grew this in 2022, so it'll be a bit more this year. These are both from Health Canada and the Australian government websites. And then total dried flower produced is 24 tonnes. So those, when you see the asymmetry there, that's why we are having the supply chain conversations that we are having. Until kind of all of us kind of get up and actually start running, then these sorts of conversations like we had today are going to continue to keep happening. I completely agree, though, that it is entirely reasonable for us to have an expectation that the playing part, the field part, be one, well-known, clearly defined, and then enforced in a fair way. Remember, patient, not consumers. I don't want us to get sucked into a CPG. I have a separate presentation for that. I don't want us to get sucked into a CPG conversation around brand, because individual brands in the marketplace inside our very tightly regulated market don't really have a place, right? Because the pathway is via a doctor, and whilst there's different jurisdictional changes, which Deepak shared this morning, generally speaking, you have a patient. So, how do we look different? How do we look better? And how do we look best? And so the purposes of the illustration is to say, there's heaps out there. How do we make, Australian product look different, better and best, which is this concept around the Australian promise. And then how does that align with the brand, the kind of producer brands or the people making the product? How does it sort of fit with their broader hierarchy? I would argue that if we get this bit right and we can actually, support the whole of industry to communicate this, it will make it inherently easier then to do the brand by brand stuff. Finally, and Rosemary shared this morning, what is the promise? Now, we're continually discussing this and evolving it, but ultimately the walk the talk piece is that you can't go out to market, and I bristle, I have to admit, at the clean and green thing, because not everybody is clean and green, but there is definitely consistent feedback from the international market that they are looking for this promise, and so we just need to position ourselves to take advantage of it. Finally, again, this is a discussion slide really. Is it about product safety? Is it about product quality? Is it about sustainability? Where does trust and social license fit? I obviously advocate strongly around delivering on promises, but it's also got to be respectful of the complexity of a supply chain, which I always describe as a sort of skipping rope, except it's usually about 50 skipping ropes, all with the same person sort of jumping in the middle. It requires a level of consistency and harmonisation between each end before it starts working properly. And so that's the work we have in front of us. Thank you. I'll hand back to Rosemary.
Thanks very much, Cam. So we'll just get our panellists up here. So Dirk's back with us, and Paul Long from this morning, and also Andreas and Kyle, if we can have them up here as well, that would be great. Stick to your seat. So what we're going to do with this session, so this is sort of what we're going to try and do is, I guess, get some of these experts to... get some of the experts to tell us how we can actually translate some of this sort of high-level concepts that Cam and I have been talking around into some action. So I think we're going to do a deep dive with Paul into a couple of Pacific markets, and Kyle's got some really good expertise around the connection of medtech into the supply chain, and we've got an international perspective as well. But I might start with you, Dirk. I think there's been quite a lot of, whilst recognising that we've all got challenges, I think there's quite a lot of optimism around the opportunity that sits there in front of us. So from you as a player in the Australian market and also someone who's involved in the industry association, what do you see as the next steps? What are some of the things, tangible things that we can do to sort of move some of this forward, do you think?
It goes back to what has been said a couple of times already during this convention, is we're talking about export here, let me be crystal clear. We need to really make sure that the message that goes out is one that is positive and that leverage that clean and green and that does exist internationally for other products that we are exporting into these markets. A little anecdote, I was talking to a company that is active in Switzerland, Czech Republic and Belgium, and to my surprise the person said, he said, but you guys are pretty much fly-by-night type of organizations there. I'm like, how do you get to that point? I was totally shocked about that. I said, how do you get to that point? And I said, can you give me one example? And he basically said, well, my business partner exports into Australia, and the party that is importing it is basically willing to bend the rules and all that to get the product into the country. So here's the perception that we basically are just not doing the right thing. So I do believe that is where we believe that our importers really can help us to get that image internationally, as well as we are a good country to export as well. So it's that kind of things that I do believe in. What I said before in earlier conventions, earlier talks, is to pretty much say to the regulator, please help us, because you can really help us by doing what we hope you would be doing. So that's one thing I believe. Yeah.
Okay. Well, for you, Andres, as an importer into Australia, there's been lots of talk about importers. Do you want to make some comments about how you see the supply chain issues?
Sure. At Cleverleaf, we have been focusing on the international cannabis market for over 8 years. We're a company that produces in Colombia, but we have to sell all over the world. And I've been listening to the talks today, and about, the importance of the Australian brand and the importance of being strict at importing. And I think all that helps, but I'm going to bring a little bit of a different perspective, having tried to enter all these markets. And I think it's more simplistic and a little bit more pragmatic, as it happens in any industry. You have to have a very good quality product. You have to have, reliable supply and not fail your agreements. And you have to have competitive cost. That's really what's going to get Australia to export, because we can, I'm taking myself as Australian, but you guys could, set standards, use the kangaroo, all of that. But, Canada also has the maple leaf, and, really that's not going to differentiate you in a world where there is a lot of flower, where there is a lot of product. So you really have to look at this from a buying company, or patients on the other side perspective. What's happening? You're seeing a lot of strains being launched, then you see a lot of strains not being there anymore. A lot of unreliability of supply. We're talking supply chain. You see inconsistent product, so that's a quality issue. You see prices fluctuating. So the reality is, as I was sitting there, is, yes, all these other things are important, but the reality is companies that have good product at good price and that are reliable are going to be able to have, Australian exports. The other things, I really believe, are just, nice to haves, but they will not get the product into Germany. They will not get the product into the rest of Europe. They will not get the product into Israel, because there is a lot of competition. Not among Australian companies alone, but everybody and their mother is trying to do this. All the countries are trying to create a cannabis, logo and all of that stuff. So it's really come down to price, quality, and reliability, which sounds so basic, but it's not there. It's not there in medical cannabis. So I do think this question about supply chain is not minor. With one additional complexity, I might add. which is, companies like us don't control a big portion of the supply chain because a lot of it is controlled by governments in different countries. So right here in Australia, what's happened, for example, with the import permits, right? It went from 2 weeks to 90 days. And you have to cope with that. But it's not only us, the companies, it's the patients, the physicians. So it's not an easy supply chain. I think this is a very important topic, and I think it's around there where really the right to win for Australia in the world is going to be determined. It's much more than the other elements, in my view.
Just a reminder, firstly I'll go to the floor. Anybody got any questions? Stick your hand up and we'll find you a microphone. Paul, let's come to you. I'm going to sort of double barrel it, if that's all right. You've got a couple of quite specific examples, and so we're kind of going to pick up sort of a thread from this morning's conversation. Some specific experience around Poland, which you hinted at, but also keen to hear a bit more about the French, the pilot work that you guys are doing there, and we might then circle back to this kind of promise piece at the back end.
Okay.
Yeah.
Just one comment to add to the last question as well. I definitely agree that they're the driving factors, but we definitely see in the market some positive feedback around Australian products in Germany, as an example. Yeah. There is a positive. You can have a positive conversation with partners over there on the back of Australian reputation, and I think there's a few companies up there that have done a pretty good job in delivering. And it's not just about price and quality. I do think following through on partnerships, paying your bills on time in this market, you're just doing the things that you say you're going to do with a partner. And I think we've got a pretty good reputation, in particular in Germany, to do that. And it is definitely an Australian reputation. On the flip side, we've seen a really interesting version of negativity around any Danish-produced flour in the German market, and we produce product out of there as well. But there's a few companies that have produced really substandard product into that market, and it's tarnished the whole country really. So when we talk about our product, being produced from Denmark, we get tainted with the same brush. So we have to say, look, come to our site, come and check it out, have a look at our products. It's not an easy sell. So yeah, I 100% agree with your comments before, but I think there's definitely an overlay of the benefit of Australia. So to jump in,
France
Cam,
and
sorry.
Poland. Yeah, no, you're fine.
Yeah.
You're fine.
So Poland, I think it's not a big and scary kind of. Yes, it takes time, but for anyone that's producing a GMP pharmaceutical grade product, then it's relatively straightforward. It's a Module 3 CTD dossier, so it's everything that you would require under a GMP license. It's obviously your stability reports, it's your primary packaging, and it's a technical dossier. It's a couple of 100-page technical dossier that gets submitted to the Polish government. For us, that took probably 6 to 9 months, but for people that are a bit more competent than us, might be more like 4 or 5 months to pull that together. But often it's just, if you're not there yet with the products, in particular that ICH triplicate stability can take time. So for us, it was about 6 months to pull together that dossier. And then you kind of sit and wait for a long time. So for us, it was another couple of years, I think, maybe 2.5 years. So I think from a decision 3 years ago where we wanted to look at the Polish market, I think there's 37 million people there. There's a 17% usage rate in the illicit market. So we look at those two factors. There was only 2 products in the market. We go, that looks like a good opportunity. MRA GMP, let's have a look at that one. And so from that moment of saying we want to do it to our first delivery, which was 2 weeks ago, was about 3 years. So it is a long time, but it's not a huge amount of, for everyone here that's producing, that you'll all be producing Australian GMP. So most of those factors, even if it's through a third party, a CMO, most of those CMOs will have a lot of those technical information, and you can pull it together as a brand and submit. But obviously it doesn't really finish there. And whilst we spoke before about finding the right partners, it's still, once it's in market, that's where it really begins, that opportunity. So we see Poland as really unique for Australian brands for that reason, because I think it will be limited. It does take time, and so it does put off a lot of suppliers out there. And then the other thing that's really interesting for Poland, and in our experience Germany, is that it has to be GMP dried. So obviously in Australia now we've accepted that we can GACP all the way through to packing ultimately. And so we cut out that GMP drying step, which does limit in some European countries the opportunity to export. We chose to GMP dry, which has been helpful in that pathway, but that could be a limitation moving forward as well. France.
Yep, pilot study.
Yep. So France is a super interesting country, and I think we're about to see some really exciting opportunity. So everyone knows there was a pilot study. The first 2 years we submitted our tender to be a part of the pilot study, and the French decided that they would submit a tender, and it was a cost-based tender originally, and then they said, look, only submit if it's for free. So look, we chose to do that on the basis again that we saw the bigger picture and bigger opportunity to support that market, and so for us it felt like a positive move. We submitted, we were successful. The first 2 years was in some ways good and bad. It was much bigger than we thought it would be. So we ended up shipping, I think, about 70,000 units of our 50ml products into that market. So it cost us a lot. But we were about 70% of the total market in France. So, all those first prescribers in France know who we are. We've got a great relationship with the ANSM and the DGS, the regulators, and we've supported them with out of stock with other companies as well. So then after 2 years, the French, being the French, decided to extend again for another 12 months. At that point, there was an opportunity to actually leverage some payment out of the relationship. So it wasn't much, but it was a nominal amount for the third year. And then at the end of the third year, there was talk about it either rolling out again or finishing altogether. And then it's now been confirmed that it's going to go into a 9-month transition period. So that starts on 1 April, goes through pretty much to the end of this year. That transition period is just the same 3 suppliers in Aurora, Little Green Pharma and Panexia out of Israel. And then it will open up into a regulated market. And again, like I mentioned before, there is a big opportunity there in terms of the volume, the recreational use as that precursor to medicinal. It will be limited. I think it's been mentioned a couple of times, there'll be no flower to begin with, so it'll be a very extract-driven market. But there will be other GMP opportunities inside that country outside of flower, which could be quite interesting. It has been touched on by Deepak earlier, so that everyone should be having a look at if they're interested in that market. It's going to be slow. We acknowledge that. I don't think that the pathway to begin with will be only through specialists that operate within hospitals. Mm-hmm. So there won't be an open access like we've seen here and in Germany with GPs. It will be slow, but every market starts somewhere. And for those in the room that were here in Australia at the start, it was specialists, it was slow, and it was like that for a long time. So I don't think we should, when we're looking at export opportunities, be scared about 3 years of waiting for a dossier or slow markets into an emerging market. I think we, particularly with what we're doing here in Australia, should see that as an opportunity. So, we think France will just evolve, begin with extracts very slowly, but we think it won't be long before it opens up into a much broader market.
Fantastic. So just a reminder, you've got the app to ask questions, and there's 2 microphones around if you want to ask a question. Might go to you, Kyle. In terms of your experience from the sort of medtech side, how do you see that we might be able to bring some of this sort of innovation or experience from medtech into the medicinal cannabis supply chain and make it, improve the competitiveness globally?
Yeah, so I work heavily in the NDIS and aged care space, as well as consulting in medicinal cannabis. So what we've realised is that NDIS and aged care in particular are very hard cohorts to convert over into medicinal cannabis because they struggle to get access to medicinal cannabis, they don't have much education. And one particular model that we've worked with that seems to have worked is the closed loop model, which I, to be honest, disagree with in many aspects, as well as a lot of people here, I'm sure, disagree with the closed loop model. For anyone who doesn't know what it is, it's basically prescribing a product that you're also supplying. But what they're doing well is integrating medtech into this. So they're essentially got a portal where a patient goes online, they access the portal, they book in with a GP, They get pre-assessed online through a questionnaire. And once they speak with the GP prescribes them a prescription. And this script is then automatically sent to partnered pharmacies. I'm sure a lot of people already know this. And then the pharmacy dispenses the product that's been prescribed. What's happening at the moment is that these businesses are actually supplying these pharmacies with their own product, which is a no-go, I feel. But I think there's a better way to do it. So with these businesses, they've acquired, in a short period of 2.5 years, 40% of the market share, which is pretty scary if we think about all the businesses that are here working hard, struggling to make profit, and then you've got these highly profitable, aggressive market share grabbing businesses that are incorporating medtech, doing often what we see is the wrong thing, but got people in the seats to make it look like it's the right thing. I feel that we could do it better by incorporating a similar model, but we could call it an open loop model, where we incorporate medtech, where we are training our own GPs, but instead of prescribing our own products, we're prescribing everyone's product, but also we have our products in there as well. Ways that we could mitigate some of the things that these guys are doing, because what's going to happen is they're going to take the whole market share. Realistically, if you look at the stats, they went from less than 5% market share 2.5 years ago to over 40% market share. And they are, honestly, one of the sole reasons why patients are even coming into the industry at such an aggressive rate. So what we could do is we could incorporate that model. We could split it up. So if someone does incorporate this medtech closed loop model, you could have your area that you have complete separate decision making within both of these functions, so that way you don't have conflict of interest. We want to make sure that patients are first, so we actually educate the patient that yes, we are involved in the supply chain as well, but also we've got 5 other people involved in this supply chain that are providing their own products. I'm going to prescribe you products that are based on, whether it be your disabilities, whether it be your symptoms, whatever it may be, so that way it's fair. And I think we can all agree on this, is don't accept commissions as part of this model. But yeah, I think we should start looking at incorporating medtech into the space, because as a consultant, you know, I've got 80 consultants that work in this space, and we are starting to work with a lot of these medtech companies, and we can see that they are taking a lot of market share. We can see that just on their balance sheets alone, they are the most profitable people in the industry. And I feel like we need to get people who actually care about the patient to be doing something similar but way better with the engagement of TGA and ODC, because otherwise what's going to happen is people are going to keep turning blind eyes, we're going to lose market share, and yeah, we don't want that happening.
Do NDIS. Does the NDIS funding allow for the payment of products?
So it does not allow for the payment of products, although I have seen NDIS participants, which I'm going to cover in our session. I think it's 4 o'clock or somewhere around there. Cover about NDIS participants and my aged care recipients getting access to medicinal cannabis. They don't actually cover the cost of the physical product itself, but can cover the costs of some of the apparatuses used to take some of the medicinal cannabis. Although I've been working on a model with some of our consultants on how we can make it accessible, because I know that the biggest pain point for those with disabilities and on the My Aged Care scheme is the cost and purely accessibility. They don't know how to access it, which medtech should hopefully cover, but the cost. So we've figured out models where by getting NDIS registered, you can incorporate NDIS services and NDIS products as part of your service offering, which actually offset the cost of medicinal cannabis itself. So that's a model that we have been working on, and we've been introducing or trialing with, I believe, 2 businesses at the moment.
Great. All right, we're going to come out to the floor. So a question. Thanks.
Yeah. I've got a question for the panel. What is the importance of technical product innovation versus the green, sustainable message or branding of Australian products in penetrating new market? How important is having new products, having innovative products in different forms?
Let's start with the guys that are in market, and we can.
I mean, I can give you my views. In general, I believe that product innovation is going to be more important in determining your accessibility to the market. Now, having said that, you have to be careful, because from where we stand and we see a lot of markets, Australia is actually a market that allows for a lot of product innovation, while there are a lot of other markets that really don't. So you have to be able to balance that and see whether innovation is possible and to which markets is possible. And I think beyond that, an add-on like the green product and all that, it is important. But I again, going back to what I said before, I think it's going to be secondary to the basic quality, price, reliability. And I like something that Paul said, which is true actually. And it is, the Australian companies, particularly, the more serious Australian companies, do what they say they're going to do, which is very, very, scarce in cannabis. And having said that, one thing that I think Australia has to be careful with, which happened to us in Colombia, is that's a very strong thing to have and something that everybody can leverage. The Australian brand, let's say, that has been built based on quality product, etc., and doing what they say they're going to do, but it's only as strong or as weak as its weakest link until somebody comes and damages that, and building that takes a lot of time and effort. Destructing that is very, very simple. So that's when associations and things like that come to mind. But that would be my take on your question.
I totally agree with that, Andres. I also believe that innovation is essential. You have to do that. The clean and green is great, but that on itself will not cut it. So you will have to have that innovation. I mean, in fact, this industry is a very fast-moving industry, meaning change really goes fast because of what's happening in the world. If you don't come with new products, new concepts, new ideas, it's going to be hard to stay competitive and really go for that premium price at that moment.
I just wanted to qualify that coming from a pharma background.
Yeah.
It looks like, sorry to say, all of you guys are doing the same thing. Okay, and it's difficult from an outsider to see the product differentiation between various companies in Australia. And I'm wondering, is the outside market that we're trying to penetrate seeing this difference? Are we getting lumped into?
Well, it's not just Australian companies, to your point, it's the Canadian ones too. Like, they all look the same, right? Yeah. Did you want to add anything to that, Paul? If not, I'll make a sort of comment.
No, you go.
Are you sure?
I think particularly on the oil front, I think, that it does feel like a bit of a generic space at the moment. And flowers are differentiating by quality and by genetic. But the real innovation should and I think will be coming out of other delivery forms.
And I think it's important to recognise, I sort of briefly touched on this, it depends, the market, the jurisdictional regulatory framework around the market is evolving quickly. And so if you split, let's just simplistically split between medical, and then inside medical, I think we are now seeing another split, which is traditional pharmaceutical versus this other pathway which has emerged and that we're all running sort of down. And then on the other one is your CPG, right? Until you get to those defined ones, your differentiation is kind of difficult to map out. So from a pharma point of view, and this I'm guessing where you're coming from, is you go and figure out a dose form, you find a way to protect it so that you can invest in the multiple phases of clinical trial, and I'm different, right? Like that's this one. If I was to make a general comment, what we've got is and I mean, Paul's been quite honest about it in terms of looking at how the market's working, in terms of how many people are there. There's definitely a positioning around it's a product for an evolving market, which is medical, because that's what we're talking about. But obviously the backdrop of it is all of these adult use markets emerging. And so I see the biggest driver to product innovation that certainly from my looking in is regulatory driven. So like the new rules around plus minus 10%, right, inherently force some innovation because all of a sudden there's a whole heap of products that won't fit into that needle that's over in that corner. And so, yeah, we're definitely seeing it. And I think based on that last panel, I think these guys all appear to be, investing into that. Does that answer your question?
And hopefully, I think this afternoon we've got some R&D conversations. I think maybe is NTI presenting here today?
I'm not sure.
So they're an Australian listed company. I think they're 90 to 100 million market cap. They've invested in their CBD pathway. I think for autism, they're in a phase 2B, and they've stuck to that course, and they haven't done it with 10, 20, 30 million dollars of investment. They've done it pretty cleverly, and they're looking, for if you sort of read where they're sitting from an ASX perspective, it's looking pretty good. Yeah. And so, we haven't spoken about that at all. We, the real, again, we've got to think about this from a patient perspective, but commercially speaking, it's the Jazz Pharmaceuticals, and it's that have really dominated the landscape over the last 20 or 30 years. And there hasn't been any talk of that, but hopefully this afternoon there's some more R&D conversations at a pharmaceutical level.
We've got a question.
Probably not so much a question as a comment. Just going back to the NDIS, I think there's probably a missed opportunity there for legal companies, because I know that NDIS really there's a group of NDIS recipients that are actually paying for their green market cannabis with the cash that they're allowed to pay through the NDIS without receipts. So there's probably an opportunity there if someone wants to take the headway.
Yeah, so that's actually what my team does. We are merging medicinal cannabis, NDIS and aged care into one industry.
Yeah. Great. Any other questions? Stick your hand up if you've got anything. No? Okay. I might go to the screen. We've got a couple here. We might just deal with the first one, Paul, with respect to France. So there seems to be a lot of talk about France moving to legalise adult use, of which we heard a little bit about before as well. Do you see this as a risk or opportunity, let's for you to start with, in your context, but obviously more broadly medical cannabis?
Yeah, so just to be clear, so France is not going to be an adult use market in our mind. It's moving to a medical market. So after that transition period, perhaps I incorrectly worded that, it'll go from a transition period in 9 months to next year into a legalised medical cannabis market only. Yeah. And it'll be a very, very high watermark of their expectation of what that looks like. Again, no flower, specialist only. So it won't be an adult use market at all for the foreseeable future.
All right, and circling back kind of to the sort of one of the big themes of the session. So from an Australian perspective, what is Australia's key competitive advantage other than obviously the country? And I'll make it just a general comment before we sort of build on. I take the key points made here with respect to product, quality and price, because ultimately that's the intersection point at the end of a supply chain, which is where people... what we do have though is we do get to stand on the shoulders of a whole heap of investment that's been made in a whole heap of sectors, which is this Australian piece, which I think Paul kind of articulated. So let's just kind of flesh that. Do you want to kick us off? Obviously just maintaining, remembering that we came at this from that work that Rosemary did, and then obviously I built on.
Again, I will quickly give two examples. There's wine being made everywhere in the world, and yet the Australian Shiraz is really appreciated a bit everywhere in the world. So if you come with the right quality, the right product, at that moment you can go into these markets. So it is for us, the producers and the cultivators here in Australia, to first of all come with a very good product that has a distinct attribute which people will value. So that at that moment, that's one. The same goes with sheep meat. I mean, we are selling a lot of sheep meat to the UK, the land of the sheep. How is that possible? How can we do that? It's because we are creating a certain value, and that is, and I'm not saying a cost, I'm talking about a certain value that we create, and that is what we need to create here in the medicinal cannabis as well. If we can really claim clean, green, and because it is outdoor, or we just have a special way of cultivating, and we come with unique terpenes, or unique cannabinoids, or unique flowers, that is where we need to go. Do not go to a typical standard blend oil that everyone has the same between quotes, but we need to find that, and that is where I do believe that innovation comes in, that's where research comes in. It's that kind of thing where we need to be good at. We've done it a couple of times with a couple of products. We can do this with medicinal cannabis as well.
Yeah. Andres, do you have a comment on?
Yeah, as I was listening to Dirk, I fully agree with that view. Further to that, I would ask myself, where is it that Australia wants to differentiate itself? Is it in the production of the products, or is it in the R&D of the products, or is it in the science behind the products? I'm not sure. Clearly, I don't have an answer. But I think it's a question that must be made, because you typically think medical cannabis market, we have to grow it, we have to extract it, we have to sell it either by flower or extract or gummies or edibles. Is that production where Australia wants to position itself? It's kind of like Apple, right? It designs products in California, yet they're made in China. China specializes in making them. California specializes in designing them.
Yeah.
Where does Australia want to position itself? I think that's a question that must be asked, because every single country in the world, when they talk about medical cannabis, well, most countries that are in medical cannabis want to produce it and create jobs and all of that. Is that Australia's advantage? I'm not sure, but it's a question that must be asked in order to define whether that's the right Australia has to win or not.
Yeah. Did you? Yeah,
Just a quick one from me. I think to answer the question, our biggest competitive advantage right now, it has been for a few years, is our framework.
Yeah.
The GMP framework in which we're all working within here in Australia is our advantage because of the MRA, in particular into Europe. And I think, Deepak was talking before about the benefit of Germany staying within the GMP medicinal framework for cannabis gives us that really significant advantage, and particularly on any kind of new products, I think, into that market.
Kyle, quick comment, and then I've got one for Rosemary, which will then wrap up. Anything to add with respect to this Australian kind of position?
Yeah, I feel like everyone's worried about my product's the best, who's got a particular type of strain and whatnot. But if we look at what the patients really want at the minute, like my consulting firm, we look after 33.5% of the NDIS. And the feedback that we're getting from them is, number one, we don't know where to access it. Number two, I just want to solve my problem and get on with my life. So I think that we need to start looking at medicinal cannabis like that. And that's truly patient-focused. So if we look at how we can solve those two actual problems, rather than looking at our business, how can we be more competitive? You look at the people who own the market share. Do you think that they care about the quality of their product, where they're getting it from? Yeah. Half of it's cheap import.
I mean that's why the industry is looking long term, because we are very focused. I'm going to close up, but I'm going to do it by a question, I guess, for Rosemary. Having done the work, Rosemary, with respect to ADMAC, but obviously all the work that we've been doing over those kind of number of years, is this something that we can keep doing as an industry? I mean, one of the great opportunities I see is we get to go and ask for funding to support this, right? It's hard to go and ask for funding to support some of these very specific objectives, but this is something we can. And so let's round up with kind of some comments from you.
Yeah, look, I think we can, Cam. I think we've really just started on the journey in a way, and all of these things, as we start to build the narrative, build the story, and create credibility along the way, then that helps elevate the industry in the minds of the government and the community. And I take Kyle's point. At the end of the day, we are about producing a product for a patient. But to get there, we need some assistance along the way. And I think it is, we do that by telling the story and by then underpinning that story with the credibility and the credentials. And I think just, the three panels had today and the openness that people have shared their experiences and their stories, I think just shows that we have matured a long way. And I think there's no doubt by sharing those, by the companies who've led the way, sharing their stories that will help everyone else build a level of confidence. And so, as I said before, it's about we need the products for the patients for the confidence, but we need to tell the same stories else in a different way to build the confidence of the community and government and the industry themselves to be able to share these experiences. And so just in the grain industry, we've got a rising tide floats all boats, and I think that's that's where we've got to sort of work together to build that.
Fantastic. All right, I'd firstly just a huge thank you to all of the panels from this morning. I hope you all got as much out of it as I did. Thank you to the panel here. We are now headed for lunch. Thanks very much, everyone.